Hi, my name is Emily Nelson. I am a women's health nurse practitioner, and I've been working with Dr. Rosensweet and Prime this last year and have just been so benefited by the program. So I specialized in women's health for my master's. I felt like my understanding of hormones was so very basic prior to starting. It was essentially a matter of providing a patch and a pill, and that was the dose and that was the go-to, and anything else needed to be referred out to someone else. So when entering, I felt like I had near to no knowledge. I started the program and felt like every single lesson provided me with a new depth of understanding, new knowledge, everything from why certain hormones are hugely impactful in a woman's life to how the menopause method, the Bright method is superior to even like walking women through this entire process down to their 24-hour urine hormone test. It was all laid out in such a clear way that starting my practice with Prime IV and with the menopause method felt very natural, and it felt like I was having my hand like held the whole time along the way. It was so interesting starting because clinically I'd been told hormones are so important and these are a million reasons why. And then when I started providing the hormone replacement for women, it not only was so easy to help them understand the process, but then it was incredible how quickly life-changing results were being told to me. Yesterday I met with probably about 10 different women, and every single one of them brought me to like the edge of tears, which is like so unprofessional, but they're all so wonderful and they're all so appreciative of the care that they receive. And it's funny because I'm like, I didn't do anything, I'm just telling you the things that you already knew. They came to me saying, I think something's wrong with my hormones. And all I said was, yeah, it sounds like there is. Let's do something about it now. And they're just like, I've never met patients or had just such rewarding turnarounds with patients whose lives are now like completely altered. Yeah. So for my career, it has placed every women's health encounter in a new perspective because I can no longer talk to a woman who says, I'm feeling really anxious and not immediately think you need progesterone. And I can't talk to a woman who's telling me that they're having struggle sleeping at night and think, oh, we probably need some estrogen and progesterone. Um, for instance, I had a patient and she came to me. She was 37, and my old clinical knowledge would have said, she's too young. She's got normal periods. Don't talk to her about hormones. She doesn't need that. But this program has taught me to delve deeper, to ask more questions. And her health intake provided so many symptoms of hormone deficiency. And so together, her and I decided to just try hormones. She had been working as a physical therapist and she had to quit her job because she felt like the anxiety that she had never felt before in this level was becoming crushing with her with her position at that time. So she quit her job and she came to me and said, I need you to give me hormones because I think that's what's going on. And I don't know what I'm going to do if this is how I have to live the rest of my life. And so we started the hormone therapy, and immediately her Aura ring said that her sleep score was better. Her glucose monitor said that her glucose was 10 points lower. And she emailed me after the very first night and said, today I woke up and there wasn't a crushing pain in my chest. And we've only seen improvement from there. She was able to stop the SSRI medications that really weren't doing anything. She's been able to increase her activity level. She returned to work. She asked for a raise that she never would have asked for before. All these things that just were that she completely attributes to the hormone replacement therapy that we were able to provide her. And I never would have considered her a candidate with my previous knowledge. And so I know that moving forward, people are going to think I'm crazy, maybe because I'm going to just see hormone deficiency in every conversation I have with patients. But it truly makes a huge impact on our quality and our quantity of life. And I can't imagine ever providing care without really speaking to the hormone deficiencies present in my patients.